Hi everyone and welcome to BFM 99.9 Podcast Breakfast. Thank you for tuning in with us today. And for your information, we will bring to you together to discuss one of the most important things in Malaysia right now is talking about vaccine. So without further delay, let us begin our session today. Thank you everyone for tuning to our radio for this morning. So I will introduce to you our expertise in vaccine in Malaysia. So I would like to welcome over here we have Dr. Kesing, Dr. Kesing Liu. Okay, we have Dr. Sharifah Mardia over here. Okay, we have Dr. Auji Azhani, and last but not least, Dr. Hong Ailing. Okay, and welcome to everyone, and yeah, welcome to my humble studio. And I'm so appreciating that you all are willing to be here to discuss about the most important thing that we should concern about, that is vaccine preventable disease. So before we begin, like how is everyone currently? Are you okay currently? Have you taken breakfast?
Thank you, Nuraini. I'm great. I'm fine. Thank you. It's fasting, by the way.
Oh yes, I'm sorry. How about the others?
Yeah, good. Thank you. Thank you, Annie, for inviting in the podcast.
Yeah, thank
Okay.
you for inviting us.
Yes, that's great because most of our followers are really wanted to know about the vaccine because I think most of this discussion is really formal and they really want us to have like informal session to talk about this matter with our expertise. Okay, so before we begin, I think at this level we know that what is vaccine so far.
It would be hard to imagine what a world without vaccines would be like.
It would really be quite horrible. There'd be outbreaks of disease regularly all over the world.
I don't even think I'll be here in a world without a measles vaccine.
The true deep impact and the global impact of vaccines just can't be overestimated.
So according to WHO, a vaccine will trigger your immune response to recognize and fight the disease that is caused by organism. So I think because of COVID, now we aware what are the vaccine. And I think it will be wise if I ask our panelists over here, Dr. Ong, when we talk about vaccine, do you actually, does vaccine is like one whole thing or is there any type of it that we should know in this world? Would you mind to explain that to us?
Yeah, sure. It's my pleasure to share my knowledge to all of you. So basically, vaccine we can divide into two types. First will be the viral vaccines, in which they can further subdivide into like protein subunit, the virus-like particle that contain a viral protein, the DNA base and RNA base, which contain their genetic material of the virus, the non-replicated viral vectors, which contain the viral genetic material, but this time they are packed into the harmless type that cannot copy themselves. The replicating viral vector, in which they are also packed into another harmless type, but they can copy themselves. The second type will be the whole virus vaccine, in which we are always hear this term, the inactivated and the live attenuated vaccine. So inactivated vaccine means that the virus itself are being killed, and the live attenuated vaccine means that the virus only be weakened.
Okay, thanks, Dr. Ong. So that means vaccine is like a part of the organism that can cause us the disease. However, this is maybe part of it like a weakened organism that it will be included in our body. So moving forward to that, actually, I think it is wise to to share to everyone that actually Malaysia we also have our own history of vaccine, so that we will have some kind of mention about national immunization program, or we call it as NIP, which is integrated in the mother and child health services. So actually this was introduced in early 1950s. So that means we have started early when we talk about vaccine. So I think the NIP program, it is based on the recommendation from the WHO, where I believe it is called by Expanded Program on Immunization Program, EPI. Okay, this is a new term for me. So the EPI actually recommended that all countries immunize against 6 childhood disease. However, Malaysia has expanded our NIP into 13 major childhood disease. This is awesome, Dr. Sharifah, would you mind to explain to us about Malaysia National Immunization Program that has been mentioned just now?
Right. Thank you, Nurani. Thank you for inviting me as well. And I would like to share about National Immunization Program, which, as you mentioned, it has started introduced earlier on in 1950. And yes, EPI recommends against 6 childhood diseases, but Malaysia our country has expanded it until 13 childhood diseases, which is very very comprehensive. And what is the 13 preventable diseases listed under this national immunization plan includes diphtheria, Haemophilus influenza, hepatitis B, human papilloma virus, Japanese encephalitis, which is obligatory in Sarawak mainly, measles, mumps, pertussis, poliomyelitis, rubella, tetanus, tuberculosis, and the latest as of 2019, we have expanded and added the pneumococcal. So the Malaysian National Immunization Program was included in the Maternal and Child Health Program, and it has actually began in 1950, which the vaccination is actually given free under this NIP for all children. And since 2015 onwards, non-Malaysian also has the benefits, and they only have to pay a minimal fee for vaccination. And with this program, actually, we have successfully reduced the under 5 morbidity and mortality caused by this vaccine preventable disease. So as I mentioned, it has 13 major childhood diseases which is covered. And from the history and progress of vaccination in Malaysia, since we started in early 1950, we started from smallpox, TT, DPT, BCG, and the list continue, OPV, measles, rubella, hepatitis, and also HIV and MMR. And the latest one is 2019, which we included pneumococcal. And will coronavirus be part of our expansion? We'll see to it later. So for the vaccine preventable diseases, what is the objective of this program is to protect individuals from the targeted diseases. And also we want to reduce the occurrence of outbreaks of the targeted diseases by creating adequate herd immunity in our population. And we will also want to reduce the morbidity and mortality due to vaccine preventable diseases, as well as to maintain surveillance on this identified VPD. We will also want to eradicate all the poliomyelitis, eliminate measles, and also to reduce this infectious disease by time. So when we want to get the vaccine, we always have in our mind where can we get this vaccination. So it is actually given or provided via the free of charge in all government clinics and also government hospitals across the country. And they are also provided in private hospitals, private clinics, but there is some fee of it if you take it from the private. And our maternal child health program also provided the school health service to protect the kids. So when we go to the immunization coverage for primary vaccines, we know that with reference to MOH data, immunization of BCGs and also other vaccines covered about 90 or 95% that shows that BCG vaccine is widely given at birth, and also other vaccination that was given in our child. So monitoring of this coverage was also made by MOH. And as what we can see from the graph here, almost more than 90 or 90%, 95% coverage is covered for our primary vaccines.
Yes, thanks, Dr. Sharifah. I think by covering, the vaccine coverage, it takes about currently 90% of vaccination coverage among the infants and also the young children. I think that is a huge, success for everyone. So when it comes to vaccine, at first before COVID, of course, before COVID, we only knew that vaccine only for children and also for younger children, for infant itself. And I think we have do a really good job for this one. So I think from the statistic, according to Ministry of Health, actually with immunization program and improvement in health services, Malaysia actually have successfully reduced the number of infant deaths by 85% from 1970 to 2017, from 55.9 deaths for every 1,000 live birth to only 8.4. So that means there's a lot from 55 and now only 8.4. I think that's a huge thing. That's a lot. And not only that, the immunization have also eradicated the smallpox worldwide, while polio also have been eradicated in Malaysia. So Dr. Kasing, would you mind to explain to us how does the successful of vaccine happen in Malaysia, especially for measles? Is it truly a successful vaccination program?
Yeah, thanks to Daniel. Yeah, just as Dr. Ma mentioned, in Malaysia we have a successful immunization national program. We can see as a measles as a example, the number of measles cases jumped from 195 cases in 2013 and to the more than 1,900 cases in 2018. And what's more, from the figures case of measles who without immunization increased to more than 1,500 cases in 2018 from only 125 cases in 2013. And regarding to the deaths related to the measles and the disease in we can see the figure from the MOH in 2018. The minister recorded only 6 measles deaths who are not immunized, and 5 cases of diphtheria deaths where 4 did not receive the vaccine, and there are 22 diseases from pertussis, and have 19 cases have not vaccination. Actually, in Malaysia, we have 11 vaccines which are recommended to get under the age of below 15. And for example, the BCG vaccines, hepatitis B vaccine, and the HPV vaccine. And I want to highlight in the age of 7, 13, and 15, the children will get the vaccine at school. So if the children who are healthy and can drop the school, so they maybe can get the vaccine. And also we also offer some additional vaccines, but this vaccine you need to pay by yourself, and you can get in the parent institution. Yes. Yeah, this is my over to you.
Thanks a lot for sharing that, Dr. Kasing. I think this is so surprising that just now you mentioned about among all of the 6 measles cases. Sorry, the ministry mentioned about 6 measles deaths, and most of the cases happen because they are not immunized. So I think from here we should know that vaccine works. Okay, so Dr. Auji, like just now Kasing mentioned a lot about the statistic from the cases, right? So I mean, like, we have all the statistics, and I just wanted to know, like, is this kind of disease is really, I mean, like, it's really something that is important, or like, how does the statistics calculated? And I knew that there is something about notification should be done to report this matter to the Ministry of Health. Like, would you mind to explain that to us about the notification system in Malaysia?
Okay, thank you very much, Naini, for inviting me. I will explain about the mandatory notification under the Prevention and Control of Infectious Disease Act 1988. As you can see at the right picture, there is a notification form that every medical practitioner or any doctors who encounter or treat the person with the disease that already recognized as an infectious disease, it is mandatory to fill up this form. So from the section A, every details of the patient has to be complete so that our officer can detect back the patient. They will counter check the number, patient number, IC number, and also the address, so that the outbreak can be localized. If any outbreak happens, it can be localized to a certain area or district. Okay. For example, the disease under this act is polio, hepatitis A, C, AIDS, cholera, dengue, dysentery, Ebola, food poisoning, gonorrhea, and there are also hand, foot, and mouth disease. Okay. Other than that, there are also influenza, leprosy, malaria, measles, plague, rabies. Okay. Syphilis, and also tetanus. All right. Other than that, it also has typhoid, tuberculosis, and also viral encephalitis, and also whooping cough and yellow fever. So under the section below, the doctor have to confirm every cases, so that they have to include the onset of the disease, the symptoms, the status of the patient, whether he or she is still alive or dead, and the lab result, whether any IgG or IgM taken for that patient. Okay. All right. So this notification is mandatory to be filled up and sent within some disease 24 hours, and some disease within 7 days. Okay. And then for rubella, it is administrative notification. And for syndromic notification, for example, acute paresthesia and fever with rash, that one have to be informed to the local health district office within 24 hours. Okay, so for the next slide, you can see the flow of notification from private hospital, private clinic, public hospitals. They have to fill up the e-notification. It is an electronic notification. The 27 notifiable disease under the PCID Act 342, and also the suspected dengue cases, okay, clinical have to be notified within 24 hours, okay. And then all the notification, whether it's an electronic or manual, it will enter into the e-notice system, and then the system will divide according to the district health office and also the state health department. And then the state go to disease control division. It will enter a specific system, whether it is measles, MyTB, NAR, dengue, or food waterborne disease, WBD. All right, over to you, Noraini.
Thanks, Dr. Haji, for sharing that. I mean, like when you talk about the notification system, it seems like the process is really detailed, and I mean, like it is very meticulous. To discuss about that things, and for us, like the public, we don't know like what are the process, and I think that we have been taken care by the Ministry of Health, and thank you so much for doing that to us. Ministry of Health has mentioned that we need to achieve a herd immunity, and so due to that, I think the public now, try to know like what are the herd immunity. Dr. Ong, like, would you mind to share with us like what are the herd immunity and why? Why we have to know that things? Is it important when it comes to vaccine?
Thank you, Aini. Yes, my pleasure again to share on the herd immunity. So definitely this is a very important concept for us to understand when we are fighting for the vaccine preventable diseases. So what is herd immunity? Basically, it is an indirect protection from one infectious disease that happened in the population. And when the population is immune either through the vaccination or they gain it from the previous infection. So if we are doing so, then we are saying that we form the herd immunity. So let me give a further explanation on this. When we introduce a vaccine into a population or a community, our aim is to provide the antibody, or so-called to make the human body to have the antibody in their body, so that the antibody itself can protect the person from being infected by the infectious disease. So we can see that from our past experience, for example, for the polio, we need to achieve 80% of the population to have this antibody in their body, either through vaccination or through the previous infection. But for COVID, we have no data on it yet. And whether we can achieve for the COVID, whether we can achieve the herd immunity for COVID or not, only the times will tell us. So herd immunity, basically, we can have a term called R0. Basically, it's a reproduction number. So this number, or this R0, basically is telling us that the number of the secondary infection, or the infection that obtained by the next person when one infection is introduced into the community. Example, when we see the R0 is more than 1, we know that basically the rate of infection is increasing in trend. But when the R0 is lower than 1, means that the infection itself, or the rate of infection, is coming down in trend. From the chart, we can see that this is a diagram to show us in an easier understanding what is herd immunity. When we look at the diagram A, when there is no immunity among the population, the red dot is the patient with the infectious disease. So it's very easy for the red dot to spread around. And all the green dots are those who have no protection at all. So they are very susceptible for this disease. And hence, the disease will spread very fast. But when we come to the B diagram, we can see that there are few blue dots. Basically, these blue dots means that the person already acquired the antibody either through vaccination or previous infection. And hence, now the red dot can no longer that easily spread around. You can see the red dot still can spread to the green dot, but the red dot cannot spread to the blue dot next to it. That means that now the community is getting some degree of protection. And when we look at C, diagram C, basically means that most of the population in the community are having the protection, which means the herd immunity is formed. And hence, we can see that now the red dot no longer can spread easily in the community. And this is what we're trying to achieve for having the herd immunity in the community. So why we need to have the herd immunity? I believe that from the diagram itself, we understand now we want to do some protection in the community, especially for those who can't really have the vaccine introduced in their body, for example, in a very young age children, or for those who are immunocompromised, or the elderly, or people with contraindication, which means that they can't have the vaccination because of the previous severe allergic reaction to the vaccines, or even to those who are vaccine hesitancy. However, we also understand that to achieve this herd immunity is not that easy, as we think of, because there are few factors that can affect this herd immunity to being formed. For example, the mutation of the virus or the new strains will cause the difficulty to achieve the herd immunity. The accessibility to the vaccine, which means that in certain areas, certain rural area, the population can't really have the access to this vaccine, and hence we cannot achieve the desired percentage. Lack of research funding, which means that we can't really have adequate knowledge to understand further on how to make the immunity being formed in the community for COVID-19. Lack of public education, which means that the public will not understand how important the herd immunity is to protect the beloved person around them. And when we have the political instability, which means that it's very difficult for the herd immunity to be formed. Now I would like to talk something on the cold chain. Basically, in a very layman term, cold chain means that it's a system to store the vaccines. We can see this very nice diagram explaining that from the factory or the manufacturer itself, when the vaccine is being produced, to the process, it being transferred to the national facility storage to store the vaccine, and then being transported to the hospital or the local clinic before they being dispersed to the consumer or the beneficiary. This is the whole process. We call it as a cold chain because what we want to do, basically we want to achieve a temperature stability for the product in this cold chain. If we still remember the very beginning when the COVID-19 arrived in Malaysia, we have seen a lot of photos, a lot of news reporting on the arrival of the COVID-19 vaccine into Malaysia. And we can see that actually the vaccine itself is being kept in a special storage with a desired temperature. And throughout the process, we can see the enforcement team is trying to ensure the smoothness of the transportation so that within the shortest time, the vaccine can be transported to the storage facility so that the temperature of the vaccine will not be affected. But from the storage facility to the nearby hospital or the nearby clinic or even to the mega vaccination center, then we will see that most of the time the vaccine will be stored in a cold box with the ice pack and also the thermal logger so that we can ensure the temperature always being kept within the desired range. And this is the temperature monitoring chart that our healthcare workers that will rely on this chart to know that whether the temperature of the vaccine is being kept in the desired temperature. Most of the time, we are aiming that the temperature being kept within 2 to 8 degrees Celsius. However, sometimes incidents still can occur, even we try our best to ensure that the vaccine is being stored within the desired temperature. So if this happens, basically the healthcare worker need to immediately record the out of range temperature and then move it to the safer place, which is the storage site with the backup. And then we need to separate the vaccine and we need to inform and discuss or liaise with the manufacturer what are their advices for the following step. So I hope you'll learn something on the herd immunity and the cold chain. So thank you. I will pass back the floor to you, Noraini.
Thanks. Thank you so much, Dr. Ong, for your, very comprehensive sharing with us about the herd immunity and also the cold chain. I really say that I don't know, what is the process of a vaccine being transported outside of Malaysia until to the end of the consumer. So thanks a lot, Dr. Ong, for sharing that. So just now, I think we have talked more about COVID-19 just now, and I think let us just watch some video in related to COVID. So please, my VT team, roll some video.
These are difficult and challenging times. We've all felt sad, worried, or overwhelmed because of COVID-19, especially as physical distancing kept us apart. How we get through this depends on all of us.
This pandemic has shown us that it does not discriminate, and neither should we. We are in this together.
Let us ensure that no one is left behind in the fight against this pandemic. This is the time for solidarity.
Let's work together to protect everyone and leave no one behind.
Everyone should have equal access to social and health services and need to feel safe. If one of us is at risk, all of us are at risk.
Be kind and support one another. Take responsibility. Show unity with your loved ones.
Stigma affects all and hurts the most vulnerable. Let us not allow our differences to prevent working together in the fight against this pandemic.
Beyond home, kindness could mean checking up on your neighbors, helping others with deliveries, or supporting those in need.
Safety goes beyond masks and gloves. It means protecting others, especially the vulnerable, from stigma based on race, religion, or socioeconomic status.
Social cohesion and tolerance is most required now to build a better, safer, and happy society to live in. So let us build back better. This is the new regular. Let's adapt, accept, and act now.
The crisis offers an opportunity to strengthen our societies against hate and xenophobia by reimagining the future of migration to ensure it is inclusive, safe, provides equal access to social and health services, and respects human rights.
Spreading kindness starts at home. Help out family, share the burden of work, and treat each other equally. Be a role models to your children.
Now, it's important to stay safe while showing care and empathy to everyone. As our world has changed, we are living in a new normal.
It is an opportunity for us to make it a kinder and better Malaysia for all.
Keep yourself informed and updated with the right information. You could access reliable COVID-19 related information from the Ministry of Health or from the World Health Organization.
We are in this together.
Okay, yes. So from this video, actually, at this time, I think who actually doesn't know about COVID-19? Coronavirus disease or COVID-19 is an infectious disease caused by SARS-CoV-2 virus. So currently, we are moving from the pandemic until and currently move towards the endemic. So I think from now we know that the virus can spread from an infected person's mouth or nose in the small liquid particles when they cough, when they sneeze, speak, sing or breathe. So this particle range from the large respiratory droplets to the small aerosols. So Dr. Sharifah, can you just share with us what are the challenges when combating about COVID-19 virus, and how is our progress so far when it comes to the vaccine itself? Dr. Sharifah, would you mind to share with us a bit about this?
So I really like your term by now. When you say that, by now who doesn't know COVID, right? So even my kids, when they talk about COVID, they are like expert already. So back to our topic today. We will briefly describe what is COVID and also what is the challenges behind it, our public health measures, and also some updated statistics about our vaccinations and active cases. So let me first start with what is COVID. The SARS-CoV-2 is the virus that causes COVID-19, and the spike protein on the surface of SARS-CoV-2 is an example of an antigen. Vaccines are the best way to train our immune system to recognize viruses or pieces of viruses called antigens. Our immune systems create antibodies and other defenses to protect us. So when a vaccinated person is exposed to SARS-CoV-2, their immune system will recognize the viral antigens and spring into action to keep them healthy, and also doesn't have so much of implication. So the next slides will be the challenges in combating COVID-19 virus. So apart from our tremendous and a very great effort of public health measures, there is still challenges in combating COVID-19, which is number one, the increase in transmissibility or detrimental change in COVID-19 epidemiology, or increase in virulence or change in clinical disease presentation, which is the mutation and variants that we see. And the third one will be a challenge if we decrease the effectiveness of public health and social measures or our available diagnostic vaccines and therapeutics measures that we are doing currently. So this is part of our challenges despite our public health measures. If we don't really cope with our SOPs, our preventive measures, so these challenges will be our problems in our community. So currently we know that there are circulating variants of concerns, which we call VOC, as what WHO has announced, which is the first one is Delta, and the variant Delta is actually also mutations, and it started in India way back in October 2020, and the latest one is the variant Omicron, which have started in multiple countries, which started last year, November. So when we come to our public health measure, what is our public health measures actually have been doing? So as we can remember, when we started our lockdown in Malaysia, or we call it Movement Control Order, which was started in 18th of March in 2020, and then it was extended and relaxed to different phases. And lastly, we lifted the movement control restriction as now we are going into the reopening. So when we go up to the public health measures, there are variations of public health measures which we have to adhere to, which is the avoid 3Cs, and also we have to always practice 3W. So what is 3Cs and 3Ws? So 3Cs is crowded places. Second is avoid confined spaces, and also social distancing, which is we avoid close conversation. And we should always practice to wash our hand and also practice good etiquette and also wear masks. Wear masks is very important up until now. So the second one is our vaccination program. Our vaccination program is tremendously working in reducing the severity. I mean, for the Cat 3 and Cat 4 patients, when they are vaccinated, we can reduce the death and also the complication and hospital admission. So yeah, and when we said about reopening, so the other one, the latest one is the trees, which is the test. So you have to get tested with a self-test kit. You have to report the test result. And the third one is isolate yourself or self-quarantine. And you have to inform your close contact and immediately family members. And you have to seek for immediate treatment to any healthcare facility or CAC if you are experiencing worsening symptoms. So these are parts of our public health measures that we have strongly implemented in our country. And we also know that the vaccination program does help in reducing the death and hospitalization, but with complete vaccination, it doesn't mean you will not contract COVID, especially with the emergence of Delta variants and Omicron that I have explained earlier. Therefore, please, listeners and everyone who is listening now, keep and follow SOP, wear your mask and practice social distancing. So avoid 3C, practice 3W, and for this, our effort to reopen social and economic sectors, as well as to live in this endemic phase safely, we need to practice the 3s. So when we go up to our public health measure, we have touched upon COVID-19 vaccine. But what is COVID-19 vaccine available in Malaysia? So actually we have 8 COVID-19 vaccine which is approved, but these are the lists that we are mainly used in our country, which is the Pfizer vaccine, which is the name is biotech community. The component is from RNA. The second one is Oxford AstraZeneca, and the third part is Sinovac, or also called as Coronavac, and the fourth one is CanSino. Moderna and Sinopharm is also being approved in our country. When we talk about type of vaccine, we also want to know about the component of vaccine, and thank you, Dr. Ong, for already explaining about the types of component of viral vaccines initially. So we have 2 categories here, which is the viral vaccines and also whole virus vaccine. So I will not explain it earlier, as Dr. Ong has already explained so much in earlier presentation, but we know that we are currently relying on this vaccine for our protection, apart from other public health measures. So for supply of COVID-19 vaccine that have been acquired in Malaysia, according to the JKJAV website, so we have the mRNA vaccine, Pfizer, AstraZeneca, and also Sinovac. And we all know that number of doses is different for each of vaccines, and their storage temperature is also different for each of the vaccine that we have to adhere to maintain the efficacy. So after we have know about COVID-19 vaccine, we will go to the next topic, which is the statistic, the up-to-date statistic as of the record until 15th of April. So as what KJ or our Ministry of Health, Minister of Health Khairi Jamaluddin has mentioned, we should be proud of our best immunization program in the world. This is actually the best in terms of coverage, speed, and also effectiveness. And the last part is Malaysian, you all came together to protect themselves and to protect everyone. But due to some gaps that we could have improved, for example, the crowded center in the PPVs, the journey of our online apps such as MySejahtera, and also communication-wise, but overall, it has been well received. And it is our one of successful story of our pandemic management. At impressive rate, we see that the effectiveness of the booster shot to keep people safe from death and complication. People will come forward and hopefully they will get booster shot when they all see the effectiveness later. And we have to be transparent and clearly communicate the risk, but we have to explain that the risk is very small and the benefits is far greater than the side effects. So without further ado, I will briefly elaborate about the statistic. So at the time of recording and up to date, going to the latest statistic of COVID-19 active cases and the data as of 15th of April, our daily cases is 9,673 as of 15th of April, which has confirmed COVID-19 cases, apart from the cumulative of cases, which is 4.3 million. And our active cases was 97.5% is mainly home quarantine, 2% is hospitalized, and 0.1% is in ICU, and only 0.1% was ventilated. And our trend is coming down, and hopefully we are praying that it will come down eventually. So if we see by state, we can see that from our total cases of 9,673 cases, we see that the highest is still in Selangor and also Kuala Lumpur, followed by Negeri Sembilan. So for other states, it's still remaining static, and also we hope that it will be coming down. So we go to the vaccination statistic. For COVID-19 vaccination statistic, by now, at the time of recording today, Malaysia has administered more than 69 million doses nationwide, and 27.6 million has received of at least one dose, while 26 million have completed their vaccination with either single dose or two-dose vaccines. Malaysia has also administered almost 16 million dose booster shot to adults, and overall percentage of booster dose intake among adults is 70% thus far. And 98% adult has completed their COVID-19 vaccination in this country, which is a great achievement in our country. So as we can see here, for adults 18 years old, this is the highest percentage that we have already received. About 97.6% has already completed two dose, and 67.8% has received booster. And we also started our vaccination to adolescents for the age of 12 to 70, which we have accomplished. About 92.2% have already completed their second dose, and booster dose is not yet implemented, but we will see the journey if by evidence it is beneficial for the adolescents to take second dose. And for children, we actually have latest statistic as of 14th of April for vaccine uptake for children 5 to 11 years old, which we started the adult PIDS vaccination this year in February, and up until now they have administered 1.6 million doses, and at least 38.9% has received a single dose, and 7.6% has received both doses. So moving on, we also received the latest news, which is the second booster dose for COVID-19. And as what COVID is already known, we have our challenges in terms of mutation and also variants. So this is actually booster dose which will be offered to high-risk individuals in Malaysia, and their objective is to increase protection against COVID-19, but it's only for high-risk senior citizens aged 60 and above with comorbidities. For the non-high risk and healthy senior citizens, they are advised to consult a doctor for second booster dose recommendation, and the type of vaccine offered is Pfizer, and their interval for second booster dose is at least 4 to 6 months after the first booster dose. So when we go around So when we go to the last slide for my presentation is the support system, which is very, very crucial for our society. So for any inquiries or any help in terms of psychosocial support, there are always a line to support which you can contact as shown here. So for any inquiries, you can call the hotline CPRC or through WhatsApp, email, or virtual CSC helpline. And for the psychosocial support, you are also encouraged to call our hotline, which is operated from Monday to Friday, 8 a.m. in the morning till 5 p.m. And this is offered by the psychologist officer in KKM and also NGO from Mercy. So that's all from me, Noraini. Sorry for the truly lengthy presentation.
No problem, Dr. Sharifah. Actually, whatever that you have shared just now, I think it is very comprehensive, and I think all of the explanation is very important to us as well. And I just wanted to echo back that if you need any support when it comes to the COVID psychosocial, you can just reach out to the numbers that we have shared just now, or you can just call the CPRC, that is 0377239300. Okay, please reach out for help, and I think the Ministry of Health and the teams are really, really happy to assist everyone in terms of the COVID itself. So, when we talk about the vaccine, right, we're also concerned about the anti-vaccine movement, and I think due to social media itself, we know that the anti-vaccine only comes because of COVID, but actually it began like far too long, even before I was born. So I think this is something that we should concern about, and I think just now we knew that even though we have achieved about 90% coverage of vaccine, but then how about the rest of the population? How about the 10% of the population who didn't get the vaccine? And I think that according to the statistic, our number of vaccine refusal is fluctuated. So some years it could be a few thousand, some years it could be a few hundreds. And from what the public have seen, we could see that maybe the widespread of advocacy effort from the collaboration of the private sector, the government sector, the medical social media volunteers have been advocating about this matter effortlessly. So Dr. Augie, like, would you like share with us like how and why people reject vaccine despite of it brings a lot of benefit rather than harm? Would you mind to share it with us?
Yes, I need. That is the most satisfied why vaccine refusal is still on, because although we are giving the vaccine for free or only a minimal charges if you take it from public sector, but still there are a number of vaccine refusal. So from this chart, we can see the state with the highest number of cases is Perak, followed by Kedah and also Selangor. There are also numbers of vaccine refusal by state. This is from 2013 to 2016. So why are they refusing the vaccine? There are several reasons for vaccine hesitancy. For example, a bad past experience with immunization. This is related to any adverse events. Maybe they get side effects. So they don't want the subsequent child to get the same immunization or for other siblings. And then there are also erroneous claim on adverse events and also vaccine inefficiency. So this will further enhance the refusal because they want a devastating effect to happen to their children. Other than that, there is also the belief of traditional complementary and alternative medicine, or we call it TCAM. So the false propaganda by the marketeers of traditional herbal remedies and health supplement has somehow managed to get them influenced. Okay, so the practice of traditional treatment and natural remedies is among the what they opt, okay, for alternative medicine. So they also believe on natural immunity. They doesn't want to get an extra vaccine from outside because they believe the natural immunity is enough for them. Okay, and then they prefer to use high vitamin doses other than accepting the vaccine. There are also some perceived religion prohibition, like the non-halal content in vaccines. However, our Mufti has already explained that the vaccine is actually halal and also harus to prevent the disease. So other than that, there are also anti-vaccine conspiracy theories. They perceive profiteering motive and also perceive Western conspiracy against Muslim. As you can see, there are certain social media that has a group of anti-vaccine in it. You can just type and search for it, anti-vaccine for COVID, for example. You can see the group is quite big, surprisingly. Okay, and also the anti-vaccination rumors and hearsay from social media is what I mentioned before, and words of mouth. Other than that, last but not least, is pseudoscience belief. They believe homeopathic vaccines more than our conventional vaccines. So there is a management flow for immunization refusal in our Ministry of Health. For parents who refuse immunization for children after they're being advised by a paramedic, a house officer, a community nurse or staff nurse or assistant MO, they will refer the patient and the parents to a medical officer. The medical officer will try to consult what are their concerns. They will deliver advice according to their concerns. So if it's successful, they will administer the immunization directly. But if it's failed, they will further refer to a specialist. For example, a family medicine specialist or a pediatrician. Okay, so if successful, they will give the immunization. But if they still refuse, the medical officer, the doctor have to fill the format for vaccine refusal and report using a standard format. Somehow, they will still get a follow up in a health clinic according to schedule. All right. So this is an anti-vaccine movement on the internet. As you can see, there are many paper, social media that shown the anti-vaccine movement, like as what you can see here. Okay, so these anti-vaxxers started in 2012, around 2012, 2013. Initially, it's a small movement, but later you can see their group in social media and they are quite loud. Okay, so the spread of anti-vaccine movement nowadays is quite obvious and they can easily influence other parents as well. So what are other critical barriers? So we also have our underlying weakness of the system. For example, monitoring challenges in tracking the unregistered childbirth, especially in orang asli and the rural population, and internal migration and movement. So the system also overloaded, and some parents also have some logistic and infrastructure problem. So other than that, there are also lack of understanding for the importance of vaccination. And last but not least, integration of immunization activity with other services and active community participation is important to ensure improved immunization coverage in Malaysia. Back to you, Nuraini.
Thank you. Thank you so much, Dr. Alji, for sharing that. And we are glad to have Dr. Alji student over here who also very excited to learn about vaccine as well in our studio. So yeah, despite of all of the reason that have been given by the anti-vaccine, most of it seems like a myth. Like example, like content of the vaccine is not halal or something. But do you think that the anti-vaccine is a threat to the population? Does Ministry of Health has any strategies to overcome this matter? Like what are the strategies? Any suggestion from Dr. Kasing?
Yeah. Actually, in MOH, we have a comprehensive strategy to counteract the vaccine hesitance. For example, we provide the feedback on patient on outcome of advised events in investigation to clarify the claims on advised events and the vaccine infections. And we also have the electrical immunization register to track the vaccination status and able to catch up the immunization. And what's more, we have a program to train frontline medical professionals, for example, to equip the doctors with skill to respond to the anti-vaccine poster in the social media. And other we have other program initiated by MOH and other agents. For example, we have a program called Immunize for Life. This is a program expert drive community education initiative to promote immunization for people of all ages against the vaccine preventable disease and to address issues surrounding vaccination hesitance and refusal. And in the local, and what's more, we have, many people may reject the vaccination because the money she need to vaccine many times. So in our national immunization program, we offer 6-in-1 vaccine and to reduce the times of vaccination. So and to reduce the likelihood of vaccine refusal. And what's more, in the state level, we also launch ongoing forums and seminars conducted by the states in cooperation with other agents, for especially the religious body, to promote implementation of the health promotion program to increase the vaccination rate. And last but not least, we also have health promotion among the mass media social, and we have anti-vaccine among the social issue and public awareness to provide the vaccine education and identify health initiatives. Yes, that's all. Back to you.
Thanks, Dr. Kasing, for sharing that. I think it is a relief to hear that the strategy is already in place in order to raise awareness throughout our community about vaccination. Dr. Ong, so at the beginning just now, I noticed that you mentioned that we managed to eradicate most of the preventable disease. So from your experience, is there any outbreak of the disease so far in Malaysia?
Yes, actually, maybe I can share a case study on measles. Before I go into the case study, maybe we can come to what is measles actually. So according to the ICD-10, basically we can classify or we can diagnose a person with measles based on clinical criteria or based on the laboratory criteria. Clinically, we can suspect or say a person with measles that typically present with fever plus cold plus conjunctivitis and also the maculopapular rash. So when we see this kind of symptoms in a person suspected with measles, we should proceed with the laboratory diagnosis. That means that we should do the blood test for the patient by detecting the presence of the measles-specific IgM antibody, or we can use the culture technique to detect the presence of the measles virus, or nowadays we can use the molecular technique to detect the presence of the measles virus in the patient. And furthermore, we can divide the measles case by saying that this is a suspected measles or this is a confirmed measles. As you can recall just now, I mentioned that clinically we will look for several signs and symptoms. By having these signs and symptoms, then we can say the person is having suspected measles based on our clinical judgment. But to confirm the person is having a measles, as I mentioned, we need to proceed with the lab test. then only we can confirm the measles in a patient. Actually, in Malaysia, we have a surveillance called the Mandatory National Notification of Infectious Disease under the Infectious Disease Prevention and Control Act in 1988. And we should notify all cases, whether it's a suspected or confirmed cases of the measles within 48 hours from the onset of the rashes. We should notify the authority by telephone, and this is required by the measles elimination program. We need to write in, or we need to fill out the notification form that shared by our panelists just now to the form should be notified to the nearest district health office. And during the outbreak, actually, the intensive surveillance is required to be maintained. So in measles, basically, we know that measles is a very highly infectivity disease. So we need to promptly act on these situations, in which means that we need to close the suspected case. We need to close the premise that with the suspected or the confirmed case to contain the infectious disease. And just for your information, actually, since the introduction of the measles vaccines, and we have already prevented around 21 million deaths globally. And this data actually is obtained from the year 2000 to 2017. So this means that by the introduction of the measles vaccine, actually it saved a lot of life. And that's why vaccination is quite important. Let me highlight again, especially for this kind of vaccine preventable disease. Perhaps I can share with you a case study that I can recall in year 2019. Actually, in year 2019, in our Kelantan state, near the Kampung Kuala called Orang Asli community, actually there was reported measles cases, and the test was done around 112 people. And among these 112 people, they detected 37 people were positive. And this was the outbreak that I can recall in the recent year.
Wow, Dr. Ong, thank you for the magnificent case study that were presented to us. But can I interrupt you for a while to discuss further about this Orang Asli measles outbreak? Yeah, because I really found it important, because in Malaysia there is some re-emerging diseases infections that has been occurring, like this case measles among the Orang Asli, and also I think there are one parts in Kelantan and other parts as well. And also apart from measles, there's polio and pertussis. So we will see that there are many causes and challenges that has been ongoing, such as in Orang Asli, which they are situated in rural, and also they have so low immunization rate, and they live as a nomadic, and as an Orang Asli, their lifestyle is nomadic, and they have very poor health literacy on the vaccine preventable disease, because actually this disease is actually preventable, but due to their poor health literacy, and also their conditions. So this is the limitation of this outbreak of these diseases that has been re-emerging, and also poor surveillance of disease among Orang Asli, and we have poor data communication on defaulter tracing for vaccination. So with the crisis, we know that learning from COVID, we actually get other benefits where we all united and there is a private and public support working together to provide services. So from my point of view, there is an opportunity. We bridge the gap, and a collaboration with the multi-sectoral, which is the private, public, defense, and also volunteers, NGOs, other government sectors, education, and also many more to overcome these causes and challenges of this outbreak among Orang Asli. So what say you?
Yeah, I agree with you, Dr. Sharifah, and thanks again for sharing with us your view. I think it's quite valuable for us to learn that also. Perhaps I can talk something on the measles elimination program that actually we introduced in Malaysia in year 2004. And actually that time we targeted to eliminate the measles by year 2010. However, we unable to achieve that, and subsequently it was revised and the target was set as year 2018. Actually, in Malaysia, there's another thing we call it measles supplementary immunization activity. We call it short form SIA. Basically, this is a 3-yearly mopping up campaign by the team going to house, means door to door. They provide these immunizations among the people and living in this area, in this high-risk area. So by hoping that we can achieve the measles elimination. And one important crucial point I think I would like to share is basically health education on the public on the importance and the significance of the immunization is one of the key factors besides the prompt reporting of the laboratory result, because the understanding of the public on the significance and the importance of the immunization actually will help us and enhance the measles elimination program in Malaysia actually.
I
And we
truly
hope that
agree with this initiative. We should always promote education and awareness to the vulnerable groups. Yeah, I totally agree.
Thank you
Yes.
so much, Dr. Ong and also Dr. Sharifah for sharing about the outbreak that is happening in Malaysia. So when it comes to outbreaks, like how does it manage, and importantly, will it be happening again? Dr. Kassim, will you mind to add more on this?
Yes. Actually, regarding to the measles outbreak in Orang Asli, the MOH launched the intervention to help the children get more vaccination. For example, we supplementary immunization activities. The 100% of the Orang Asli children at the village have received the immunization, and we also do the health screening. To the people at risk to detect the people infected with measles, and also we do the health promotion. For example, we teach the children about the hygiene, food safety, nutrition, and also the importance of immunization and the early treatment. And also we also in cooperation with the other institutions and the NGO to improve the nutrition and general hygiene. And also some intervention in the local development department. For example, we have a vaccination program. The district health office has initiated the vaccination program for the Orang Asli from also have an intervention conducted by the local department. For example, the Orang Asli Development Department launched a vaccination program, which was initiated by the district health office to help to prevent the spread of infectious disease. And a total of 204 Asli in the 2 villages have received the vaccine injection so far. And we also have the community empowerment. And to my knowledge, I know the Malaysia Pediatric Association also involved in the strategy, right, Dr. Ajib?
Okay, so there are interventions also done by Malaysia Pediatric Association. For example, in education, they are sending trained teachers and doctors to educate the Orang Asli on the importance of immunization for the prevention of illness and disease. So this community will make a change in mindset because it is important to teach the young ones earlier. So the local health and education officer also take it upon themselves to push the indigenous people's agenda initiated by the local pediatrician. So and then the best way is to teach the young ones directly and through their own mothers lah. Okay. So for vaccination, we know that the best prevention against measles is only through vaccination. The immunization strategy for the population has to be strengthened besides help their nutrition and also their general hygiene. We can see among Orang Asli, they are severely malnourished. So the effect or complication will occur due to these measles. So the government and NGO can cooperate together to look at the reallocating manpower and funding resources to help this neglected population. So as a summary, for the case study measles outbreak among Orang Asli people, vaccination is the key of preventing the measles outbreak, and multi-sectoral approach, for example, can provide a more holistic prevention and control for measles. This tracking device for defaulter tracking for the family, so Tok Batin or Jakua can help in tracking the patients for immunization. Other than that, Ministry of Health, MOH, and also MOE can improve health literacy of the community and children via health education on the importance of vaccination. Community empowerment with Jakua and Tok Batin together with the government and NGO can help in providing sufficient nutrition and general hygiene to the community. That's all about the case summary. Aini, back to you.
Thank you so much, Dr. Kassim and also Dr. Augie, for sharing about the strategies that will be strategies in overcoming the outbreak. And I think this is one of the longest podcasts that I have hosted before, and I'm just gonna say thank you all of the expertise here for willingly to spend your precious morning to discuss with us about vaccine. And I think that learning from your experience, I believe that the vaccine preventable disease is still a public health issue, and our children are at risk actually. And despite of the incidence of vaccine, the vaccine preventable disease in Malaysia has been reduced significantly, and I think some of the regional goals also have been achieved, but some of the disease re-emerge, like maybe endemic in the neighborhood countries, about the immigrants and globalization, and also disrupted by the herd immunity itself. So I think the vaccine preventable disease can be preventable and can be eliminated provided that the vaccine acceptance among all communities will be achieved, and then we collaborate more with the multi-sectorial, and I think we should sustain completion of primary immunization more than 95% at national and also state level. I think learning from like our proverb or something, we always knew that prevention is always better than cure. And yeah, I hope that this conversation will benefit our BFM 89.9 listener. And yeah, please give us some feedback and share, like, and comment, subscribe as well. And yeah, I'm gonna see you all in the next podcast episode. Thank you everyone, and have a good day.